I saw that under each article, everyone had the same gripe. It was reaffirming and it was infuriating at the same time. How is it that this country, which claims to be one of the most prosperous in the world, can't take care of its citizens? Hey y'all, hey y'all, hey y'all. Welcome and welcome back. I am not going to be on here for a long time, but I'm going to be on here for an introspective time. I want to talk about two of the major stories that have been taking over our news cycle over the last couple of days. These stories highlight just how broken our healthcare system really is, from Anthem's reversed anesthesia policy to the shocking of UnitedHealthcare CEO. It is clear that Americans are fed up, and it is with good reason. Let's start with Anthem Blue Cross Blue Shield. The insurance giant recently proposed a policy that would have capped anesthesia coverage during surgeries. Imagine going into a procedure knowing that there's a time limit on how long your insurance will cover your sedation. Beyond that, you're on your own. How does this make sense? This all came in the middle of another story that I'm going to discuss. And so people were fired up. The backlash was swift. Anesthesiologists, legislators, patients, they all called out this absurd and arbitrary policy, and Anthem immediately reversed course. Isn't that interesting? And they claimed that the policy was being misunderstood. But it was not a misunderstanding. You have the likes of the New York Times all the way to the Daily Beast covering this story, and there was no misunderstanding. It was a calculated move that put profits over patient care. But when the people had a reaction, they quickly pulled back. And I wonder if we can do that consistently. Then there's UnitedHealthcare. Just this week, their CEO, Brian Thompson, was tragically ended in Manhattan. And the crime scene included messages, I'm sure by now y'all have heard, on the casings, delay and deny. These words, y'all, are painfully familiar to anyone who has had to battle with insurance companies. Let me be clear. Violence is never the answer, but the reaction to his death on social media and news comments, it speaks volumes. People were not mourning. They were venting. There were comments like, "Unfortunately, my condolences are out of network." Y'all, the deep anger and frustration that so many Americans feel towards a system that denies them care in the darkest moments is understood. United denies 32% of in-network claims. In-network claims. That is double the industry average. So patients are left fighting for basic care while they're trying to, battle things such as cancer. Meanwhile, executives like Thompson are earning, $10 million alone in the last year. This isn't frustrating, it is infuriating. So what do these stories have in common, y'all? They are both reminders that our healthcare system, it isn't built for us, it's built for profit. Anthem's policy reversal and the reaction to Thompson's death, they both highlight the same truth. People are tired of being treated like numbers on a balance sheet. Americans are over it. We deserve and pay for, get that part, a system that values our lives more than its bottom line. Y'all, I have my own stories around this. Interestingly enough, I'm battling something right now in this very moment related to healthcare. We all have these stories, and that should not be the standard, should it? I wonder, will these incidents spark meaningful change, or is this system permanently broken? I do not believe it is the latter. I believe that there is the possibility for collective change. I want to hear from you. Let me know in the comments what you're thinking about this. I told you I would not be on here for for a long time, but I would be on here for an introspective time. This has been on my heart. These conversations will continue. Please be sure to share this with your guys or your girlies. Don't forget to like and subscribe. Take good care of yourselves. And remember, until next time, y'all, you are capable of big things.